Let's get this party started. All right, we are live. Let's keep things going. And then Taylor, you can just talk in the back if you want. We won't distract me if you talk in the back there over there.
Okay.
Is everything plugged in too? Everything's good? Okay. I have no juice. I can't work without juice. All right. Juice, good. Okay. Number one thing is this page here. Okay. The outline allows us to kind of walk through everything in my mind in detail. I go on tangents all day long. I have problems like that. Okay. So what I want to do is start with how the body forms. And the biggest thing up here says the purpose again is understand chiropractic philosophy shifts the patient's idea of how to control things really with good nutrition, good exercise, and also maintaining a healthy nervous system. We'll talk about what that is so everything stays healthy. My job again is to make sure that you stay healthy enough to where you don't need me or Dr. Weaver or chiropractic or medicine or surgery to maintain your health. And things are going to happen. We make it by a Mack truck. It's going to happen. How do I get healthy so things don't happen like that? I can maintain that when I'm 20, 30, 40, 50, 60, 70, 80. I did a podcast video interview with a lady who does, she won't tell me her age, probably in her 60s, but realizes she's more in her 40s based on her health. Okay, Chris, come on in. I'm going to do the class with you first. And what we'll do is do the adjustment afterwards too.
Oh yeah, sure.
So grab some paperwork from Miss Taylor too. She'll get some paper in a second. So grab some here if you like, wherever you want to go.
Oh, okay.
And there's fine too. There's like a little closed circle.
Yeah.
Smooth and easy. Okay. So, and also pen too. Pennage or a pencil or number 2, whatever. Got it. So this is going to be our first page here. We'll walk through this all at once here. Okay. So the goal again is to make sure we get your body healthy so you maintain that. That's the key. Number one thing we will talk about is how the nerves form and how your body forms with the nerves. Because the physiology is important to understand because it's your body. And everyone's body is about the same. We talked about we bleed, we breathe, we do all the normal stuff together. Everyone has conditions, type 1 diabetes, cancer, heart conditions, rheumatoid arthritis, but those are more rare in our chiropractic setting than more common. Okay? So one thing is when the egg and sperm come together to form everything and start moving around in there, you have what's called the mesoderm. Okay, that's once those egg and sperm come together and form the human body, this is the first group of cells that start dividing and making the overall body form. So the first thing that happens in differentiation, how the body moves around, is going to be your primitive node and your primitive streak. What do you think that is in the human adult afterwards?
Skull?
Yes, what's inside the skull?
Brain.
Yes, the brain. Perfect. 2 points, 4 points. Okay. So what do you think is inside here? What's this?
The spine.
What's inside the spine?
The nerves inside the spine.
Well, the spinal cord, right?
Okay.
Okay, good. So all this is this is the main thing in your body after 7 days fertilization that forms your body. It has to work from here out. It's a system, and the system happens all the time. For the most part, to a perfect example of how the body should work, because we are being perfect. So from here to here, we have the brain and the spinal cord. We want things to work together, communicate, right? So the brain sends these wires. Slippery hands today, very slippery. From the brain to the opposite side of the upper body and lower part of the same side. You can walk me, go ahead.
You're okay.
We'll be in the video, but there you go. See you tomorrow. I sit down though.
Thank
Easy.
you. Thank you.
Okay, you're welcome. So here, other side, same fingers come down from the spinal cord, upper side up, opposite side, and then here too. So everything works together, coordinate. This is your wiring system. This is our own old telephone line that people sometimes still use, or wiring system. Bye, Taylor, thank you. So you want things to realize it still happens in the body. The body still works that way. When you do anatomy in a body, doing chiropractic school, you break down the body to its muscles, nerves, arteries, and veins. They all work together to communicate everything in the body. So if this hits everything, all the organs, all tissues, what happens next is that the body forms different organs, say kidneys. Let's do the heart in red because we've passed Valentine's Day, but we can call it like it's kind of close all the way through. And also systole liver in the middle. Okay, so that's obviously a bad artistic skill of the body, but you get the idea of where all these nerves hit these organs so they control the organs as well as everything outside the body, such as the muscles, the arms, and some people have arm pain, leg pain. Same thing, we control that by our nerves. Our nerves are telling that arm or leg muscle that it's causing pain to let your body know. It's intelligent, it's smart.
So,
Yes.
Doctor, just said the green and the green and the blue lines just indicate the body structures like nerves.
Exactly, more the nerves.
Oh, okay.
So it just a prime example
So
of
the kind of same stuff, just a different.
different present. Yeah.
Okay,
So
different
for example, left side, right side of the brain.
Okay.
That it's called spinal tract. It actually controls different parts of the body.
Okay.
So your right side controls your left side upper arm, and then lower part of that right side.
Oh,
So you
okay.
split upper body and lower body, left and right side.
Okay.
So to cross over in the spinal tract and the spinal cord itself to control other things. But those nerves in general that come from the neck, for example, they control the arm, the body, the hand, from the lower back, down the leg, down the groin, down the hips. So everything in here is coordinated together.
So then why is the main dominant hand will be right hand? So is that like just the right side develop first and left side develop first, right? If you are right
Well,
handed.
everyone's different with that. It's how you grew up.
Oh,
And I'm assuming what I've read so far, your dominant hand, dominant side, your coordinated side is more how it was nurtured.
okay.
How afterbirth
Oh,
you got
okay, so
those nerves
the
to form.
development
Realize
after birth.
our body is still growing physiologically
Mhm.
until we're about 2021.
Okay.
So everything still needs that stimulus from the outside, and that's why play is so important. That's why even with kids too, so we keep moving around as kids, our nerves are still developing,
Oh,
our
okay.
organs are still
Same.
developing too. So it might be part nature,
Mhm.
but more the nurture afterwards.
Okay.
How our body responds to our environment. If we have a very closed system, our body as you grow up may be very closed and very
Mhm.
stressed all the time. By doing the movement, by doing the coordination, for example, writing with the left hand a lot when you're a kid, that becomes that's how you develop.
Left hand.
You know, or throwing a baseball or
Mhm.
playing pool, whatever it is. That point, that you learn that over time.
Okay. Thanks.
Can I answer your question?
Yeah. Sure. Thanks.
Good. I have answers for everything. Sometimes I don't even know. I'll sound confident and it'll be okay.
Yeah, sure.
It'll be-
Definitely have some
Okay.
questions.
So here too, nerves go down the arms and hands. Again, I'm not an artist, so I drew fins as a sea turtle or something, whatever you want to call it. Okay. Any questions about my artistic ability?
No.
Good. Okay, let's get this out of here. It's embarrassing sometimes. So what I'm talking about now is how the nerves work, part of your paperwork, and how they function to control everything. And why can they be healthy or unhealthy to make your body healthy or unhealthy? Part of that here is called your electrical response. In here, it says it is an energy and electrical impulses that travel from the brain, spinal cord, through the nervous system, to all tissues of the body. Okay, so here, what we do is draw the nerves as more like a tube at this point. So it'll be very simple, here, here, and here, okay? Tube A is gonna be your normal nerve. Normal is gonna be exciter and pain. This is gonna be more of a weak nerve, okay? Ever take, I think it's a calculus trigonometry. You have different type of wavelengths. We talk about nerve impulse or electricity. Your nerves travel electricity from the brain, spinal cord to every organ of the body. Our body's a low voltage spinal cord, low voltage and generator if you want to call it that. So with these nerves, if they're normal, they travel what's called a normal sine wave, nice and smooth like a wave, all the way through. Okay, nice and calm, right? I felt calm just writing it like that. I felt calm. Okay. So from there, if we have a nerve that has gone from normal, where it's being pinched somewhere in the body and cause pain, becomes very erratic, or becomes very excited all the way through the body. So that nerve becoming excited makes the body become stressed, causing the muscle to tighten up and causing pain. Okay. Over time, if it stays that way, the body's intelligent, right? It doesn't want to die. So what it'll do is make that nerve start to calm down here. So the muscle goes from tight and painful to weak and numb. That makes sense?
Mhm.
So
So
This
I
is
have
physiology.
I have the electric, like the relief, like machine.
Yeah, the
so
mu-
they
muscle
plug-
stim,
yeah, the
right?
muscle stim.
Yes.
So it's kind of just makes pain, like the wave to go down.
To go down, but also to go back to normal.
Normal. How did this work? Like the
It
physiology?
tries to function at the normal muscle
Okay.
contraction
Mhm.
and allow things to get back to normal. To resets the muscle contraction.
Oh, so it's like just to get to the tempos back to the normal.
Exactly, gets
Okay.
that tempo and back to normal position. So those muscle stim units are great. Different settings on them, especially the high-end ones,
Mhm.
where you can go, do you want to excite the muscle? Do you want muscle repair? Do you want
Yeah, yeah,
circulation?
sure.
That put different settings for that too,
Mhm.
which is phenomenal.
So they have different frequencies with words. Like
That's what is a frequency.
So
Allows it to change the frequency over time.
So if you if I want to do just the pain relief, I would use the low frequency to just go back normal. If I were to go to the warm up, like kind of before the game, will be the high.
It'd be the higher frequency, more muscle contraction. You always want to start low first, let it warm up,
Okay.
and go higher and higher and higher.
Oh, okay.
That's the plan, and over time you want the muscle, in a therapeutic sense, you want the muscle almost fatigue
Mhm.
to make it stronger too.
Okay.
But you still need the joint motion too,
Mhm.
so everything works in coordination.
Okay.
But someone had just a muscle problem here,
Mhm.
the legs working well, at that point you can get things to get back to normal where the other side is.
Mhm.
At that point they even themselves out. Because realize when you're getting muscle contract,
Mhm.
you're still sending signals back to the spinal cord, back to the brain,
Mhm.
hey, something's working now.
Okay.
Someone's had a stroke, for example, too, the muscles paralyzed,
Mhm.
getting the nerves regenerate back to where they need to so the body can function at a normal level.
Yeah. Because I saw like some sprinters, they want just their warm up routines will be includes those like the electric pulse
Exactly,
and
then
stuff.
things will move themselves,
Mhm.
especially with high-end athletes.
Mhm.
They'll get that contraction so the muscles are firing even before they have to fire.
Oh, okay.
So you get the blood flow in there too. By muscle contraction, causing pressure change,
Mhm.
the blood flow will happen, get new blood in the area,
Mhm.
get the joint to warm up, and
Mhm.
also muscle be ready to go. Huh? Phenomenal.
Yeah, yeah.
I'd rather just go warm up, do a little on treadmill and ready to go.
Yeah, I
Done,
know.
ready to go, easy.
The technology is amazing.
Technology's great,
Yeah.
but I'm not like Kobe Bryant.
Yeah, yeah,
you know?
yeah.
I'm not some high-end athlete. Any questions about this?
That's good.
Good, okay. The last part on that first form talks about the subluxation. And what that means is that how it does, and we'll talk about this in a second, how do these nerves coordinate? So if it's being pinched in the body there, in the spinal cord, how does it make that nerve fire where it can cause problems with not only organ function, but also muscle problems too? A lot of people come in here with neck pain, back pain, but my questions for them are sometimes, I know you have back pain for a long time or neck pain, but do you feel like you're off, or your balance is off? Do you feel like you don't sleep well? Do you feel like your body's under tension all the time? It can't relax well. So our job is to make sure we control the nerves, because that controls that system too. So your muscles feel better, but also your body feels more relaxed and more balanced. That's why we're here.
So some people have like disabled like just after the neck once
Yes.
they hurt their spines, but
Paralyzed.
the organ is still working. So
Yes.
how does it work? It's because the wake impulse still like goes through the spine and but the normal
Exactly that.
impulse. is
That
not.
nerve root, that spinal cord, can be pinched in some areas, but it can still cause the muscles to function normally over time. So, or the organs function over time too.
Okay.
But the problem is sometimes those nerves will control, for example, the heart, or the lungs. And if it controls the lungs, and those nerves get pinched in the shoulder blade, for example,
Mhm.
can shut down the lungs.
Okay.
So spinal cord injury, sometimes someone has a fall in a swimming pool, right?
Mhm.
And they want to brace them right away. They want to go, and so you look at them and you go, it looks kind of extreme, but then realize the long-term effect can shut down organs, not just cause a break in the bone
Yeah,
or
yeah,
muscle
yeah.
pain.
Mhm.
That's the benefit of being more proactive and preventive than trying to, well, maybe they'll be okay. It happens all the time.
Yeah.
So you gotta be careful with that
Okay.
too. Okay, that's the issue. You wanna make sure the body's functioning well by the nerves being non-pinched. Second page. Here. 2 pages together. Amazing. Side to side. Here, and this is the nerve chart. This is the important one. This talks about how the spinal cord looks and location of each nerve in the spinal cord, the joints, and that goes to different areas of the body, and that causes symptoms or effects. Okay? So we want to make sure you understand that every joint in the body between the bones, a nerve comes through there in the spine. If that's working properly, that area does not go into dysfunction or stress. We want the body to stay normal. If someone has those symptoms on the right-hand side of the symptoms, we know the body's being dysfunctional at those areas. We trace it back, reverse, where the spinal cord is being affected, that nerve, we can get that area to loosen up, get that body to feel better. Okay, any questions about that? Yes. Let's go through some examples. So exercise, these are the 5 factors of health. Number 1 is exercise. Factors of health. Okay. This allows you to understand, if I'm healthy, I should feel good when I do good things for my body. So exercise is 1. So using the paperwork, the nerve chart, talk about subluxation at C6. How does it affect both the muscles and organs? Okay? So you go down to C6. Right, 1, 2, 3, 4, 5, 6. Talks about location and being neck muscles, shoulders, and tonsils.
So it will be close to the scapula, right?
Exactly, right around here. Actually, a little bit higher than scapula. The scapula is going to start at T1, T2, right about here.
Oh, okay. So it will be just on the triceps.
Exactly, more triceps, more upper traps. That area too. So to cause that issue, neck muscles, shoulders, and then stiff neck, pain in the upper arm, tonsils, and cough, cough. So those, not only do those nerves affect problems where it goes down the arm, right? Here from that C6 area, it also causes problems where it can affect problems in the actual jawline or lymph nodes in that area. It's all part of it. Okay? So again, the nerves control not only the muscle you would feel, or down here, but also the organs related to those areas, even the lungs. Any questions about that? So I have someone coming in here this year, end of last year once, 2 years ago again, where they are having chest pain. You go, I'm not a cardiologist, I don't do chest stuff, I don't do heart surgery. I don't like blood, not blood thing. Unless it's a rare meat, I'll take some blood for rare meat, I'm good with that. But the problem was, their body was so stressed this way, they're hunched over so much, their nerves pinched in the back to make that happen. So the heart's normal, but the stress on the body, the nerves, made that heart stay under stress. Nerves were being affected the whole time. Okay?
So I saw like some people said that just the pre-evidence for like just shocks.
Yes.
And will be just your mouth will be go like other ways, and your eye probably just up down and.
Well, the drooping of the eye.
So it's kind of just based on the C4, like kind of stuff.
It's more C4, but also C3 too. So all those areas are affected where our trigeminal nerve branches off of the actual cranial nerves and also part of the neck nerves to control both eye pressure and also jaw and muscle pain.
So they said if you find those like this effect, you probably need to get some aspirins and also some like lay down to just bring you like head. Like
you want to get that separation over too. So by doing those inversion tables for one, get the body to open themselves up.
Okay.
Anytime you can open up the nerves in these areas, get the spine to open up, you're gonna feel and see improvement.
So emergency, like I say, any emergency situations, we should just get some massage for those side, or like.
It depends on what you're feeling, because if you're having more of you can't breathe, you're gonna feel like you're having a heart attack, get the medical care first.
Okay.
I'd rather someone call an ambulance and get checked out and spend the time with that, so you don't miss those problems. It's gonna happen.
So
you don't know
before the ambulance arrive, we should just do.
I would do more of the ice packs. Calm down the nerve first.
Oh, okay. Cool.
At that point, let things get the swelling calm down, especially if it's trauma involved. So your body cannot swell up. The more it swells, the more it's going to cause more symptoms.
Okay. Got it.
Sometimes that can cause this heart rate to stop, your lungs to stop, or even your brain to swell, cause too much brain swelling. Encephalitis or something like that. Let's call it something like that. Some crazy word. Okay. Down here, the very top part of the second page, where it says exercise again, last one would be subluxation at L4. So you go to L4, across that nerve chart again too, you have the very bottom here. Talks about affecting the prostate, the muscles of the lower back, sciatica nerve pain, and also the symptoms of sciatica. Lumbalgia is basically low back pain, painful back, and urination and backaches. Okay, why do you think it says prostate? You can even go ovaries, things like that too. Why do you think it would cause problems with that? I think that works. So here here, if I push in the lower back, right, the lower back nerves, L4, causes sciatica leg pain.
Oh, okay.
Okay, that's part of it. That's what you're going to feel. But also people have problems with lower intestines and also the prostate and other organs, female organs too. I laid to Martha about probably 7 years ago, no, probably more than 8, 9 years ago. Came in one day and goes, "You may be pregnant." I'm like, whoa, whoa, whoa. I didn't do any of that stuff, wasn't me. I mean, but we were able to get her lower back better.
Mm-hmm.
So they're her and her husband trying to have a baby,
Mm-hmm.
and now their back was better, and hence, with nothing else going on, now they're having, I think their 4th child.
Oh, okay. That's great.
I know, that's 4th child is crazy. Crazy. Zach, you'll find out eventually.
I know, yeah.
Not yet, not yet. But that's her body saying, now I'm relaxed, now my body can work better,
Mm-hmm.
now my body can function at a normal level. See, we had a patient, I think 4 years ago, Chris, was it? Young kid, 24, 25, horrible back pain. It was like severe, intense pain. I took the X-ray, it was like, yes, this is why you're worse, go see a surgeon, you're done. Accidents, trauma, playing sports too. His back, biggest thing he had was, the alarming thing was not just back pain, but it had not gone to the bathroom for about 3 days. He had not to urinate or defecate at all. Again, those organs control what? The prostate.
No,
So the prostate's under stress. What happens is the prostate under stress? It contracts. Constricts. It's like arteries do in the neck. They constrict. So if it constricts, it won't dilate to allow the urination to flow.
Okay.
And as we realize, there's things that patients will tell us that can either be good or bad for the body, and sometimes you think it's okay, but like, that's not a good thing. Based on experience, based on just knowledge, what we've done in the past. Okay? So what we want to know is someone's history, and is it emergency? If it's not, great, you're in the right place.
Okay.
But as chiropractors, we're a specialty. We work within a certain range. If you're outside that, yes, you need medication, yes, you need surgeries. But if you don't need that, we treat that without needing that in the long term. Make sense?
Mm-hmm.
Good, just want to make sure.
Do I know any research about like feet massage combining with the chronicles will have better influence for the lower body side? Because I know a lot of people do the feet massage to recover their.
It does work from the outside in,
Okay.
which is phenomenal. But if that's all you need. But if it's the nerve firing again, causing that sciatic pain, the nerve pain,
Mm-hmm.
and at that point you have to fix the problem causing the pain.
Oh, okay.
Not just the muscle around that area. So people have problems where they have a nerve being pinched in the piriformis muscle here.
Okay.
You need the nerve released through that muscle.
Okay. That's
Okay.
the sound, the connections just all the way down to the bottom of the feet.
That's it, all of it. So people will have pinching in the muscle will cause those problems. I had patients coming too with neck pain before, and they had neck pain, shoulder pain, like it doesn't feel right, and it was going even in the head too, causing pain around his head. Severe headache, like it doesn't seem right.
Yeah.
Had an MRI done,
Yeah.
and he had a tumor on his nerve.
Oh, that's bad.
So I'm like, this is why you're not
Stop.
improving. See, my goal with Dr. Weaver too is, can we see someone for 2 weeks and get improvement?
Mhm.
Can we see someone improve? If not, you're in the wrong place. Especially when there's severe pain. Well, let's see where things go. It's too exciting for me. Too much exciting. Okay. Next one here is diet. 2, diet. Okay. We all want to eat healthier and look better and want to make sure but we can still want to enjoy our foods, right? But the problem with T6 area on this form, go back to this form here, T6, the nerves also control the stomach. The stomach's under stress from the nerves being irritated. We think it'll digest food better or worse? What do you think, Christy?
What did you say? I'm sorry.
So if the stomach is under stress, because the nerve's being pinched, causing areas of either stomach or gallbladder or even pancreas too, at that point, will your body be able to digest the food you eat?
Oh, well, I'm sure it can, but probably not the way it should.
It'll dysfunction or have a lower function.
Mm-hmm.
So probably start having GERD, start having acid reflux too.
Mm-hmm.
Your body starts feeling like, I just don't feel right. So what we do as chiropractors, we check out your middle back area, we see if that's a problem, so everything in here gets affected, that whole area. All those organs in that area get affected. Want to make sure they're working properly. So people come in and sometimes, I had a guy come in here, Roman, about probably 6-7 years ago, and he said, I can't make my Wednesday appointment because I'm having gallbladder surgery. I'm like, oh, I don't have a gallbladder problem. Well, every time I eat foods, I just don't feel right, it feels bad, and I know I have the back pain too, but I want to make sure I take care of my gallbladder. Well, wait a second. You didn't think it's bad enough to take it out because he didn't gallstones. He wasn't in severe pain. He says, well, they just want to take it out because they think it's not an organ you don't really need. I'm like, you need all your organs. It's not organs you don't need.
Yeah.
It's there for a purpose. So he decided, you know what else can I do? As I said, try some apple cider vinegar, flush everything out, use that for a few days, get your body healthy, because he just wasn't healthy overall. At that point, over a period of 2 weeks, okay, I feel better now. In the same, I think a different workshop I had, I had ladies come in like, that's funny, because my doctor told me the same thing. I had surgery. Tell me eat greasy food now, as I take my medications, because I can't eat the greasy food without the medications. So realize what sometimes we tell you as doctors, do your own research. Get a second opinion. Is this the healthiest way for me to proceed for the rest of my life, or can I do something less aggressive and treat it that way?
So I know it's like some girls in residential days, they just try to limit their just food digesting
Yes.
and stuff. So it's kind of called the anorexia.
How you spell it?
Anorexia, or just hitting the eating kind of stuff is the symptoms.
I'm not sure.
Yeah, so it's kind of just the stuff, just the people hate to eat, like they don't want to eat. Kind of.
Yeah, they feel too nauseous.
Yeah, nauseous.
Nauseous.
Yeah, nauseous. Yeah, nauseous.
Yeah, at that point, when they feel nauseous, do you want to eat? No. Because your body tells you you're going to get more sick if you eat. People sometimes take pills, they want to lose weight. It makes them sick when they eat too much.
So basically, if you can use the chronicle to reduce those.
You can make your body function better.
Okay.
So if your body functions better from the big perspective, you can digest the food better.
If you can use some massage daily basis, will be helpful.
It's going to help everything.
Okay.
It causes more circulation, more movement in the body. Even with massage too, get the organs to de-stress overall. Again, work from the outside in. As long as you don't have a nerve problem, the outside in is not a problem. That's why exercise is so important, because exercise gets your body to recirculate the fluid through your body, make the muscles and joints move, make your body stronger. Movement's so important to your body. It's huge. It's huge.
6T, is that scapular or it's a lower median?
It's more thoracic.
Oh, okay, so it's
More thoracic. It's going to be thoracic. L is going to be the lumbar area too. Yeah, low back. Okay. Next one is going to be sleep. Who gets a good night's sleep every night of their life? I don't. We want to be able to make our body rest and relax, right? If this should happen when we're sleeping the most, if we can't sleep well, our body wakes the next day under more stress, tired, fatigue, sometimes anxiety too. So sleep, if you go to C1, the very top nerve root, talks about the location it controls the blood supply to the head, pituitary gland, scalp, bones of the face, brain, inner and middle ear, and sympathetic system. Okay, that sympathetic system controls your body sympathetic, how you relax, and how much you stay under stress. Okay, so let's do sympathetic here. This is my favorite part. It's my own personal preference. This is your stress response. Okay, we need this as we were all once cave people, to where this got us to run away from the tiger. Remember that story? Fight or flight? We want that working properly. At that point, if I see something coming after me, I'm like, hey, get the heck out of here, come on. And especially a ghost or something, because ghosts are real, right?
Totally.
Want to make sure everyone's on the same page. I watch some of those haunting, like My Haunted House, some cheesy ones. I'm like, those are still scary. Have to be real. Low budget, but they're real. Okay. This gets your body to respond naturally. Long term, it makes your body change to adapt to a stress, to make your whole body increase your stress state. What I mean by that, if our body's under stress from a nerve injury here, or even a foot or an arm or shoulder injury, that tells our brain to fire certain hormones to stay under stress. Hormones go to every part of your body, every organ, every tissue, goes through your whole bloodstream. If your body's under stress, are you going to have problems where you can't sleep well? Where, like it says here too, it's headaches, nervousness, insomnia, head colds, high blood pressure, migraine headaches, nervous breakdowns, crazy things like that, amnesia, chronic fatigue, chronic tiredness. Okay, I had a lady come in here. She's a nurse because her husband's a doctor. They work together in an office. Comes in because she has high blood pressure. I know the nerves work well. Adjust my neck so I can have a high blood pressure down. I'm like, good, perfect, no problem, easy. Okay, but she understands the science. She's a nurse. She understands the science behind that. Part of it too is here. If my body's under stress, and it hits all the hormones, right? And your whole overall, every organ in your body will be under stress too. So we have to get that nerve to calm down to reverse that stress state to go from sympathetic to parasympathetic. Sympathetic. Sorry, my penmanship is pathetic. Apologize. Okay. So where every organ tissue has that nerve control to it, at that point it can calm things down to better state. Our job with you is not to take away your pain. Our job is to calm down the nerves so your body can stay in a balanced state between the sympathetic and parasympathetic, to control your environment, to make your body more tolerable to stress. Some doctors say, quit your job, become a yoga instructor, Pilates instructor, and just live in Zen the rest of your life. That's not practical, and I would punch that doctor in the face. Okay? Because you have to realize, what can people do to tolerate more stress? If their body's under stress, it's not because they have a lack of medication. Because their body, there's something in there being dysfunctional, it's not working properly. So that's why I ask people, how do you sleep? Do you sleep well? Do you wake up better? Do you wake up recharged? Part of that question is to make sure your nervous system is working properly. If it's not, let's make sure everything you're feeling here works better, so here works better. Your quality of life is better.
Yeah, sometimes people wondering their sleeping problems because the mental issues, but actually it's physical issues.
Well, and sometimes it's both. Sometimes they just can't relax. Their body is, when you go to sleep, all of a sudden the monkeys in your head start spinning more and more and more. You go, I have to do this tomorrow, I have to do this tomorrow, I have to worry about this. Versus, and when that happens, like a physical stress, your body's a difference. That's why when you sleep and have a nightmare, I have them like every couple of months. At that point, you wake up like, I just got chased by a tiger. I just almost got eaten by a shark. I just almost got bitten by a snake. I've had these dreams, people. These are real dreams for me. Wake up and you're like, I feel like I'm running. I feel like my heart rate's up. Because your brain doesn't know. So your body responds to that stress as it would a physical entity in front of you or a ghost, because they're real. We talked about.
So the spine axis area is quite vulnerable, so we always say, so what should we do for relief this side?
To make sure that your body stays flexible and strong in this position here, right? In a better position. If our body is strong here, and then the bones move normal, then your joints move normal, so you can load them to make them stronger, but still maintain the motion of the joints.
Okay.
At that point, it doesn't pinch the nerves, causing problems with your normal activities every day.
So we should massage this one somehow?
Massage, stretching. Stretching is huge.
Stretching like this.
More the lateral motion talked about before.
Oh, more so left and right.
Left and right side. At that point, the body stays loose when you work out, so you have a stronger muscle. But as we know, when the muscle gets stronger, it gets tighter too.
Yeah.
So as you build up strength, build flexibility.
Okay.
I stretch every day. I use a roll every day, which is, it used to hurt, but it doesn't hurt anymore. But at that point, keeps my body.
Roller is good one for just the neck side. But some people said that roller is not quite good for.
No, it's too small of an area. I'll do more of the stretching, more of the towel stretch too.
Okay.
We use a towel where you lay over the towel. That's a good one too.
So I showed the leg cross for, right? The two rolls.
Exactly. Yeah.
Can we use this one like this on here?
Exactly, on both sides of the muscles, and calm down, sound like your head fall over there.
Okay.
Keeps it loose.
So probably lean on the on the walls to.
I would almost do it on the floor. At that point, your body opens up that way more by on the floor.
Okay.
See, when you're relaxed doing the stretching, it's more of a deep ligament stretch, not just the muscle stretch.
Okay.
So you want both though. So you want to do it for a longer time for the ligaments, short time for the muscle.
But sometimes people said if you just lay on the walls, the whole body weight will be on the neck will be too much, and on the walls will be reduce those stress a little bit.
I'd rather do the floor, because the floor, when you're on the floor, you're flat, and there's less weight, less load-bearing stress.
Okay.
When you're standing up or sitting, there's more of the weight of your head on your spine, so you can't really relax as much.
Okay, so probably just the leg will be bring up a little bit to reduce those.
Yeah, more bend as you're on the ground. Bend your legs up so your knees are off the ground. That point your feet are flat.
Okay.
So you want to position yourself where you feel comfortable too. So people can't do that.
Yeah.
A guy coming in, Jason, he can't go to his left because his pain is so severe.
Okay.
Even lying on his back is too severe.
Mm-hmm.
So what I do with him is lie him on his side.
Mm-hmm.
That point for right now, when he feels better, we'll go back here and here and here.
Mm-hmm.
But over time, wherever you are at, how do you change that so you become more flexible and strong at the same time?
Mm-hmm.
Okay. Next one here is called PMA. What does that stand for, Christy? What do you think?
Personal.
Nope, nope. No, sorry.
No.
0 points.
Adjustment.
No.
No.
Zero,
No.
negative points, -4 points.
Going down fast.
It's positive mental attitude.
Oh,
Oh, amazing.
look at that.
Without that, it's hard to follow habits, hard to change your habits, hard to sit in a lecture for 34 minutes with me because you'd want to leave. Okay, comedy isn't that good, obviously. Part of it is making sure your body, you have the right attitude, but realize if your body's under stress, what happens? You become nervous, anxious, depressed. You get more grouchy. So you want the body to relax so you can have this, so you want to exercise, you want to have better nutrition, you want to sleep better. You want to do these things so your body get healthy, but without the attitude, you're not going to be motivated to. Sometimes motivation for guys' motivation is, I can't move, I don't want surgery, I'm in too much pain. Women are more like, I'm sore, but I want to get better so I don't get sore. Everyone's different. People come in like they belong in urgent care or emergency room. Some people are like, oh, you're okay. So wherever your state is that gets you here, I'd rather have an attitude where it's positive versus out of desperation. That's too exciting for me. Drains me every day. I go home and take a long nap every day at lunch. Okay. Next one here. Is there nerves on that? No nerves on. That's one. This is the most important one, people, so pay attention. Say, wait. Oh, it's late. H, N, S. What does that stand for? I know, it's a big one. Christy, you can try again if you want. I know you're like overwhelmed with all these abbreviations. What do you think, Zach?
High nervous systems.
Those are big words. I would never use big words. $5 words, $62 words. I think. Take out the H. What else? What could it stand for?
It's control calling organs.
Well, it's not nervous system.
Yes, it is.
Oh, well, you said nervous
It's a
system.
part of it. I don't use other big words. I want to make sure we're clear on this. Do the right points. Say the right point for the score. Okay. Healthy nervous system.
Okay.
Yeah, H kind of throws everybody off.
Yeah.
What? That's not fair. Life's not fair, people. Let's enjoy life, whatever you can do. If this is working properly, which we control, chiropractors, hence is what we do, then everything here, 1 through 4, exercise, diet, sleep, and your attitude can stay at a better level so you can change your habits. You can see the benefits of that. That's our job to make sure you understand is we're going to help guide you through that so as you feel better, better balanced, stronger, more flexible, maintain those habits. And give you the tools, exercise, the routine, the stretching so you maintain it on your own. Again, my job is make sure that we see you enough so you don't have to see you. That's when you get better and say that's why you're here, Zach, to make sure you get that balance back. Things are normal, that the shoulder doesn't hurt anymore. Same thing with your neck and shoulders too. Getting your overall life to where it feels stronger and better. We feel our age with energy back again too. Realize when we're in a stress state where our body is more stressed, our body, that's our normal state. So sometimes we want to feed that with bad foods, not exercising, just things are like, all right? We have to change that. It's sometimes gonna suck. Sorry about YouTube, don't ban me, please, again. But it happens to where it's gonna hurt. It's gonna feel uncomfortable. It's gonna feel sometimes like, I don't wanna do this anymore. But the benefit is by going through that, the long term is you get out of here in a relaxed state and you make that your new state. So sitting this way doesn't feel good anymore. This feels better.
Yeah.
When you miss the day at the gym, you're like, gosh, dang it, I should have gone today. Because that's your new habit. You know, you may eat good for the rest of the week and go, you know what, I like that food better now. I don't like sodas don't taste very good anymore. You do things that are healthier over time as you build up one routine, another one follows through these. It's sequential, it's domino, either good or bad. But coming here, our job is to make sure you leave healthier and you have habits to maintain that. Okay. Any questions at all? That's my spiel on a Tuesday night, once a month, every month for my new patients.
Thank you.
Any questions?
No.
Find them, get them, maintain them, wherever you are. Everyone said, I feel like I'm in there 90 years old. when they come in, Molly, I should be able to tell her name, she's fine, Karen's fine with her mom's name. She was blind in a walker, now she's using a cane, she can see better. It's amazing, wow, it's weird.
Yeah.
It's magical. In the sense where I don't know what it is. It's the nerves working better, your body's working better. Like she's moving better, she's moving around. With seniors, it's tough because we need them mobile to be independent, so they don't fall, they don't cause a break in the bone, they get off the floor on their own.
So my mom has the stiffer spine, the asthma spine.
Osteoporosis?
Yeah, osteoporosis.
Yes.
So I think this problem is about the inflation of the spine cord a little bit more. Right?
Exactly, it's actually more of the bone density decreasing over time. So what happens with someone who has osteoporosis, they move less because they're more fragile. The problem is you have to do more controlled by like Pilates or yoga to make their muscles and joints stronger.
So the credit also can help a little bit on this one to just.
You want to make sure it's safe to treat them to cause more circulation in the joints. At that point, work on them enough. I have people that are osteoporosis in here.
Okay.
At that point, make their body looser. They can do the workouts.
Okay.
Do strengthening.
To use the muscle to control those like the.
Muscles control the actual bone movement, but we have to cause the motion first. The scar tissue out there, so actually things move better. First, get the glue out, and then things can improve on their own. All right. Anything else? Thanks for joining the class. Thanks for watching on YouTube. Get the video too. And I have your both emails, correct?
No, I don't have them.
You don't have my email?
Yeah.
Sad. Horrible is that. We'll get yours too. What I'm gonna do is email you the video when I put it on YouTube.
Okay.
That way you have the links and you can watch it over and over again.
Okay.
A lot of education for me is repetition, so I learn the habits and maintain them.
Yeah. Thank you so much.
You're welcome.
Thank
All right.
you.
You guys have a good week.
Yeah. True.
See you tomorrow.
Friday.